Very early on in our life, we ran into a very human problem. Someone in Gitika's family got diagnosed with an aggressive hematologic cancer. And my father and my aunt both got diagnosed with aggressive breast and prostate cancers, respectively. Even though we were connected to a lot of hospitals and health centers, we found that it was really difficult for us to come to a clear decision on what was best. If there is a wrong treatment, there's a loss in clinical outcomes in terms of quality of life, in terms of survival. And it really struck us that if this was the situation for us, then how was someone in rural India who had a lot less access to healthcare and experts and information? Gitika and I started Navya with a mission that every patient across India has the right to an expert opinion, to know exactly what their diagnosis is, what treatments are available. Navya is a technology platform that synthesizes all the information about the patient and brings it to them at the point of care. We use a validated data model. A data model is nothing but knowledge about what is important for different types of cancers. Some hospital worker who doesn't even have a medical degree is able to just input their files into the Navya Earthshot system. And then the system automatically matches those to all the NCG guidelines. For breast cancer, for oral cancer, for lung cancer, so it tells them right then and there, these are the diagnostics that are missing. So they can get that done at some local lab without having to travel all the way to the cancer center. And then once those diagnostics are done, a preliminary treatment plan is proposed based on the National Cancer Grid guidelines and feeding all that information in a very concise way to the doctor so that the doctor can then just say, yes, modify this, change this, add this. All our initial work was piloted, validated at Tata Memorial Center under senior leaders like Dr. Rajendra Badwe and Dr. Sudip Gupta, who've advised our initial building of the models. And we have data to show that we've been able to reduce the time to first treatment from an average of about 6 weeks without Navya down to about 3.5 weeks with Navya. We've completed an entire validation of close to 1,000 patients in Tamil Nadu, in Andhra Pradesh, in Assam, as well as in Maharashtra, where we were able to essentially gather feedback about how Earthshot was performing. And what we saw was a significant satisfaction among doctors. These are all underprivileged patients who are receiving healthcare through various central government schemes or state government schemes or NGO schemes. Doctors have been invariably positive about how it is highly concordant with the NCG guidelines, how it's reducing the number of referrals that they have to make to hub centers and tertiary care centers. And they say that it has significantly saved them time. We are achieving extremely high levels of quality in the output that the system is able to generate, where we are, for different cancers, getting between 90 to 95% alignment and concordance with the NCG guidelines. Dr. C.S. Pramesh, who is the director of the National Cancer Grid, has presented data on the effectiveness and the impact of Navya at the American Society of Clinical Oncology in Chicago, about how Navya actually is saving patients time, money, and is providing them with expert opinions in rural India without people having to travel all the way to Mumbai from, say, West Bengal. Without a funding partner like ACT and an intellectual thought partner like ACT, none of this wouldn't have been possible. We want every patient in India to have a right to knowledge about their diagnosis. We should be in all 28 states in India. We should be in every single tier 2 and tier 3 city in India. We don't need cancer moonshot. We need an Earthshot.